All heart surgeons in the world want to have the ability to take better care of their patients. And in order to take better care of our patients, it's fundamental for us to be able to track the outcomes of the operations that we do and study methodologies and tools to be able to do a better job taking care of our patients. So today I spoke about the act of creating a database to keep track of all of our operations, to measure how the patients do after these operations, and to be able to then compare the outcomes of any given hospital to data across the world for that same operation. In the final analysis, we can create a database that allows us to compare how we do surgery in a single given hospital to how that surgery is done around the world, and we can learn what we do good at and where we have opportunities to improve. And then we can figure out ways to make any given program do even better. Heterotaxy syndrome is a complex disease. And for many, even in the medical field, it's challenging to define. In the human body, when we're born, certain organs are on the right side of the body, like the liver, and certain organs are on the left-sided body, like the spleen. In heterotaxy syndrome, organs are not on the proper side. Sometimes the right-sided organs are on the left side, sometimes the left-sided organs are on the right side, and sometimes all of the organs are jumbled up. So heterotaxy syndrome is a problem where the organs are jumbled up and not on the right side of the body. This is very relevant for heart surgeons because babies with heterotaxy syndrome often have other problems within their heart, and the surgery to fix these other problems is often complicated because the other organs in the body are not on the proper side. I believe that it's incredible the amount of work that has been done by this foundation here in Bogota, Colombia. This foundation has saved thousands of lives of children, and the complexity of the surgery has increased every single year. And the foundation has made major efforts to collaborate with other international centers so that the standard of surgery each year here gets better and better and better. Nestor Sandoval is a surgeon who is known throughout the world as a high-quality pediatric heart surgeon, and Nestor and his team here do an excellent job. And the work that is done by this foundation is tremendous. It has saved countless lives. It has led to the development of a large and growing hospital. And not only has it improved the care of children with heart disease in Bogota and in Colombia, but I think it's improved all of medicine in Bogota and in Colombia, because by improving the quality of care for children with heart disease, the remainder of care across all of medicine also improves. International conferences like the one that we're having today are very important for the education of physicians, both the physicians hosting the conference and the physicians visiting the conference. We all learn from each other. Heart surgery is done to treat very rare lesions, very rare problems, and the only way we learn to do better is by studying the outcomes of these operations across the world. And when surgeons and cardiologists come together from across the world, we all learn from each other. The surgeons practicing in developed countries learn from those in developing countries, and those in developing countries learn from those in developed countries. This bidirectional exchange of knowledge is why meetings like today are so important.